Hello, I'm Joel Lazar. I'm a family physician and I'm a medical director at Dartmouth Health Connect. I spoke today on levering relationships to transform primary care.
Thanks for your presentation today, Joel. How would you describe or summarize your work in relational coordination that led to your presentation here today at the Roundtable?
Well, everything that we're trying to do in our primary care practice really centers around this core relationship between our patients, their primary care providers, and a team of health coaches. While I'm fairly new to the language of relational coordination itself, as I've begun to engage in that literature, I'm astonished at the connection between what that body of literature is about and how it is that we're trying to go about the work that we're doing in our practice.
What are the key takeaways from your relational coordination work that you presented here today?
I think there are a few. First, it's clear to me that relationship itself needs to be the central focus of everything we do in the practice, and everything else needs to build around that to affect the kind of changes that we want. Second, that everything else is also very important. You don't just snap your fingers and say, let's have a relationship. You need to build structures in terms of your business model, in terms of your IT system, in terms of the physical structure of your practice, around your work processes, all of which is supportive of that relationship. Otherwise, well, there's no coordination.
As the Roundtable topic today focused on working together, building knowledge and advancing research and best practice, what were the lessons learned that you captured in the RCRC Roundtable dialogues, discussions, and reflections?
You know, I've had learning on several fronts. I think most importantly, if I was to name one thing, it's my appreciation that there are techniques which I now need to engage in and learn more about to go back and measure this idea of relationality in a more robust way. I have an intuitive sense that relationship has been core and has been a real value adder, both between us and our patients and between we, the members of the team. I'm intrigued and excited to see that RCRC has some tools that may permit us to sort of get a bit more rigorous and quantitative about how it is that we're doing in terms of building that relationality.
Finally, what are your next steps as you develop relational coordination in your institution and with your patients?
Well, there we are again. I'm going to take some of the literature and the learnings from today's session, study them more deeply, have some conversation with Jody, frankly, and begin to think about how it is that we apply this model to our own measurement of how it is that we're doing on this very core area, which is how are we doing with the relationship building itself.
Joel, thanks for your presentation today.